Hey everyone, I'm your host Anthony. We do content like this weekly, so hit the subscribe button and ring the bell to get notified. If you want more content like this, click the like button and please leave a comment. Thanks again for watching.
Hi, everybody. My name is Cody. I'm with Rupa Health. I'll be your host for today. Today we have David from Heads Up Health giving a presentation. He will be going through a slide deck. Just a few housekeeping things. We have everybody muted. Any questions that you have will be sent to me. At the end of the presentation, we'll then ask those directly to David. So awesome. We'll get started.
All right. Check. All right. Well, thank you, everyone, for joining. And today I'll be presenting on remote patient monitoring with a special emphasis on integrative practices. I came across Rupa a few months ago. It just seemed like there was a ton of synergies between our two companies. I love everything that's happening over there. So we've just started our partnership, and just excited to present this new opportunity to you guys and just explain more about what remote patient monitoring is. You may have heard the buzzword before. You may even have looked into it in different capacities, and hopefully I can give you some new insights and new perspectives on how to use it. And I will be speaking to the remote patient monitoring opportunity, both as an opportunity inside of insurance participating practices and also inside of integrative practices. And just as an aside for Cody, I'm still, looks like, responsible for admitting people in the waiting room here, presumably because I'm the host. So I guess I'll just have to manage that as best I can going forward. In any event, we will be presenting on new care models that are built around remote patient monitoring technologies and how we can use remote biometric data that is coming off of consumer grade sensors and wearables, FDA approved consumer grade sensors and wearables, and how can we start to use remote health monitoring, whether it's a continuous glucose monitor, a blood pressure cuff, an Apple Watch, an Oura Ring. How can we start to use this to optimize outcomes, dial in the lifestyle factors that are driving an individual's health condition, whether that's exacerbated blood glucose, sleep apnea, sedentary behavior, stress levels. We now have the ability to really kind of see what's happening to people between the visits and fill in the gaps. And that data is incredibly empowering for the individual. It's extremely helpful for the practitioner to understand the lifestyle factors driving outcomes. And there's actually a very exciting opportunity to now start to bring health coaches into the practice to start to assist with a lot of the day-to-day remote monitoring. And this is the new care model that is emerging. It's being supported by a lot of changes inside of the payer system. And there's also a lot of opportunities just for straight up cash pay practices as well. So that's what we'll be diving into here. And we'll be focusing on the following. First, we'll just do a level set. You know, what does remote patient monitoring mean exactly? How is this relevant for you as a practitioner, especially now? There's in the post-pandemic, if you can call it post, I don't even know, but there's just been significant changes at the regulatory level around telemedicine and the guidelines being relaxed. There's been significant changes in the ability to use medical devices remotely for treating patients. There's new CPT codes that have come out to make these remote models highly profitable that did not exist just a short time ago. So we'll cover the why and the why now, especially. What is the benefits of doing a remote health monitoring program using sensor technology and wearables? And lastly, just how do you bring in a coach to do a lot of this day-to-day monitoring? That really helps the program scale. And coaches are trained to be specialists in positive behavior change, positive engagement. And the data creates an unlimited opportunity for patient engagement, positive reinforcement, lasting behavior change. So these are what we're going to focus on for the rest of the time here. And I'll keep an eye on the chat here. I'm getting one message saying there's a lot of background noise. I'll do my best to try to minimize that. It's just a function of where I'm at right now. Let's see, close the chat. So what is remote health monitoring? First and foremost, why is it relevant? First of all, it is remotely monitoring the health parameters of an individual. And that could be their blood sugar data coming from a glucometer or a continuous glucose monitor. It could be their heart rate variability coming from an Oura ring. It could be blood pressure. It could be the quality of their sleep. It could be their physical activity. It could be the food. Hugely important understanding what people are eating and how is that affecting their health outcomes. It's all monitored virtually. It emphasizes prevention, and it helps empower individuals to connect their decisions to the data and learn how to make better choices. It's also technology focused, so it's using the latest and greatest digital health technology. These products are designed and engineered from the ground up to be as user-friendly as humanly possible. And so these companies have, let's just take Withings as an example, millions of users with their consumer products, beautiful user experiences. And that's really where a lot of the technology is going, is consumer-centric health monitoring technology. And how do you bring that into the practice and make it part of the care plan and part of the program? And then how do you monetize that, which is what we'll be going into. And as I've mentioned already before, the data just creates myriad opportunities for patient engagement, especially when you can provide opportunities for positive reinforcement when you see the numbers getting better. So this is just some data on the adoption of consumer health technology. Estimated 215 million wearables active in the market by 2022. The sensor technology just keeps getting better and better. The data just is becoming increasingly passively collected, which means the patients don't actually have to do anything. If they've got a CGM on their arm or an Apple Watch on their wrist, there's incredibly valuable data, resting heart rate, blood pressure, blood oxygen, blood glucose, all coming in continuously contextualized. So it's seeing rapid adoption. It is providing data contextually where increasingly the patient doesn't have to do anything. There's just a feed coming into you that provides incredibly valuable information in the care plan. This is teaching individuals how to self-manage. Now, there's 70 million Apple Watches out there, largely becoming just a massive health sensor. There's hundreds of thousands of people with Oura rings and Keto Mojos and other devices, and these people are learning how to self-calibrate their health using this sensor technology. So how do we bring that into the practice? There's been a lot of questions around, okay, this technology is awesome, my patients love it, but how do I bring it in and use that in the care setting? And that's what we're going to continue to dive into here. So just at the policy and the regulatory level, and we're now at a point where the public health emergency has basically accelerated telemedicine significantly. The guidelines around telemedicine and requirements to be in the state of origin have been relaxed significantly. The FDA has expanded the use of devices for remote monitoring. And you can appreciate that in the COVID era, if the person can be at home and measuring their temperature and their resting heart rate and their blood pressure remotely, and they don't have to take the risk of going into the clinic, that's just going to provide a better situation for everyone. So that's why the FDA has got behind the use of digital health devices for remote patient monitoring. It's also why CMS and other carriers, Aetna, Blue Cross, have also gotten on board and starting to reimburse for remote patient monitoring. I'll go into more detail on the codes here momentarily, but it's actually creating a recurring monthly revenue stream for providers that want to get into this. And then there are policy changes driving increased regulatory breakdown to give patients more access to their health data. That's just making it easier for everyone in the integrative space to get access to patient data that's typically been locked up inside of patient portals where it's been very difficult to get access to it. So this is coming from the top down. It's also coming from the bottom up with individuals who are becoming extremely comfortable with the technology. And a lot of the technology, honestly, that individuals have is better than a lot of the technology that they'd find in an office because people are measuring every single day. They're measuring contextually. They don't have to do anything. So instead of looking at one data point in isolation when the patient comes into the office, you now have 6 months of data. And you can look at averages and maxes and mins and start to get a much better picture of what's happening between the visits. So just taking a closer look at the technology, and on the left, you can see a couple of the most common devices out there: continuous glucose monitors, Apple Watches, Garmin watches, Oura rings. The individual is monitoring from the comfort of their home. They don't have to come in the office to provide incredibly valuable biometric data, especially data that's helping understand the lifestyle factors that are driving their condition. Remote monitoring integrates the latest digital health technology. So CGMs, Oura rings, lab testing results. This brings in the latest and greatest consumer tech. It gives the practice and the practitioner a digital health strategy. And we have a lot of practices and practitioners now actually including the devices as part of the program, because it provides, first of all, so much insight into that person's health. Second of all, it's highly engaging for the patient. And now there's new revenue streams. So there's ways to integrate all the digital health tech into the programs and protocols you run. For a lot of people, they develop an incredible sense of peace of mind, knowing that their data is being monitored remotely, especially if they're in a high-risk situation. Cardiovascular disease, type 2 diabetes, respiratory infections. Just knowing that if a value goes out of range, that someone is on the other end and is going to follow up with them provides incredible peace of mind for many individuals, especially when combined with alerts and notifications, where you can even say, if this person's blood glucose goes above this value, I need to get notified. That's the level of insight you can get 24/7, 365. And I'll go into more detail on how you actually operationalize that as we go, and where the responsibility lies in these types of solutions. And I'm happy to take questions on that as we go. When we talk about monetization, typically before the remote patient monitoring codes came out, there were two options. It was really, the practice would include remote monitoring as part of their program. So if you were running a concierge practice or a membership practice where it was on a monthly basis, you would include the remote monitoring as part of that. There's also ways historically to do it as programs, where you're doing a 3-month weight loss program, a 3-month sleep optimization program, a 3-month blood sugar reduction program. And these are programs that would be time bound. And those are still valid. And for a lot of cash pay practices, this is an excellent way to include digital health devices and include remote monitoring. And then the payer model is relatively new. And there's now CPT codes for, quite honestly, doing what a lot of integrative practices have been doing for years, which is understanding the lifestyle factors that are driving a health outcome, engaging at the day-to-day lifestyle level, and then providing coaching, education, consultation at a day-to-day level. And the CPT codes now provide a very significant revenue stream for practices that are participating inside of the payer system. We actually have a lot of practices we work with that are getting back into the payer system, because in addition to RPM, there's been a number of other changes that have made it actually quite favorable for integrative practices, whereas in the past it was not always profitable for integrative practices, simply due to the fact that they're looking at complex cases. They take way longer. The reimbursement models just don't make sense. The documentation requirements were extremely challenging. A lot of that has changed, and I can provide links to some excellent webinars that go into much more detail on how the payer system has changed as well. So these are examples of some of the codes for remote patient monitoring. The codes for remote monitoring and digital interactions are increasing. So for example, clients or patients uploading images from their phone, nutrition logs, skin lesions, anything uploaded digitally, there are codes around that. Digital communication through text message and secure messaging, there are now reimbursement codes for that. Remote monitoring of physiological parameters. So I think the train has left the station, and we're seeing significant opportunity for remote and digital interactions that simply did not exist before. You can also combine the remote patient monitoring reimbursement codes with cash pay programs for the same patient at the same time, as long as there's no overlap around those two. So that helps out significantly, especially if you're doing things that supplement the pure remote monitoring codes like nutritional therapy and coaching and group sessions. That stuff all can complement RPM codes. And we love the model of a health coach in the practice that is running the day-to-day RPM and combining their skills around patient engagement and behavior modification with the physiological data. That is an incredibly powerful combination. So just a bit about the codes. Every time this is if insurance participating, I want to go deeper into the CPT codes specifically. This doesn't apply if you're working straight cash with patients. That will be obviously separate depending on your program and your practice. But it's reimbursed for device, and these are the CMS codes. So these are going to change depending on the type of insurance and where the person is. But at a minimum, it's $114 per patient per month. So this is recurring revenue. Every month, these codes can be rebilled. As long as the data is flowing, it's being reviewed, the person has an eligible condition, it starts to create a significant revenue stream. So with just 10 patients on a remote monitoring program, it's an additional 14,000 per cohort, per 10 patients. If you get 20, 30, 40, 50, it starts to get into the hundreds of thousands of dollars per year very quickly for, quite honestly, doing things that a lot of integrative practices are very comfortable doing, which is lifestyle-based health monitoring, combined with a health coach. The health coach is now driving revenue inside the practice as well, because the health coach can do 99% of the remote patient monitoring work. So that's why the health coach is perfect complement to this type of remote monitoring. The coaches are now approved and able to do the day-to-day remote monitoring. As I mentioned, their skills work great with the data because there's so many opportunities for engagement. The best performing RPM programs actually use a health coach as part of their programs. And I'll have a case study at the end of a very successful functional practice that is doing exactly that. And the coach helps answering questions, providing expertise on data interpretation, providing positive reinforcement as the numbers get better on a day-to-day basis. So it works out to be a really nice partnership when you bake a coach into the solution. It also helps with patients that may be not technologically savvy, but you definitely need them providing some data remotely. It can be used with clients who are not using devices at all, and they just need to report on things like energy levels, mood levels, alcohol intake. Subjective things can also be part of a remote monitoring program, also ideal for health coaches. And then the ongoing support, behavior modification. So RPM plus health coach is a model we're really, really excited about, and it puts the coach in a very strategic role in the practice. We actually have an online course of our own specifically for health coaches that want to go deep on remote patient monitoring. And I think this is the last slide, but this is just a perfect example. Glad MD, Dr. Jeff Glad's a very successful functional practice. His health coach, Marina, does all of the remote patient monitoring. They put all of their patients on keto mojos. They're measuring glucose daily. They have different programs around ketogenic therapy. They've done programs around fatty liver reduction using ketogenic therapy. They have weight loss programs around ketogenic therapy. The patients are trained on how to measure at home. They're trained on how to enter in and out of ketosis. They're trained on metabolic flexibility. They're trained on how to use the dashboard. In this model, it's all completely cash pay. It uses a device. It's included as part of the program. The coaches do all of the work, and it's been very successful for Dr. Glad and his coach, Marina. So I know this was brief, but I thought that we'd keep it short and sweet here. Just in summary, and we'll take questions. In summary, remote monitoring with digital health devices can be beneficial both to insurance participating through the new codes and cash practices that want to run programs around health optimization, longevity, fasting, weight loss, nutritional therapy. Having people engaged with data remotely creates a much more engaging program, and it definitely helps improve outcomes when everyone's on the same page with the numbers. It gives you as the practitioner insights into why some clients are responding extremely well on a protocol and some aren't. And that's data you might not otherwise have been able to see. The new codes are ideally suited for lifestyle optimization and making small day-to-day changes over the long term that improve the outcomes. And I think that's a big part of why these programs are seeing strong adoption inside the payer system. Again, health coach plus RPM is a magical combination. those two just work together hand in hand. You don't have to do it that way, but we've seen excellent success in that model. The consumer grade digital health technology, it's just getting better and better and better. The data is getting better. The data is getting more accurate. The data is getting sent in passively. There's less the patient has to do on a day-to-day basis. That's leading to better compliance, better outcomes. So the consumer health tech just gets increasingly more sophisticated and awesome. If any of you have worked with some patients or clients, just putting a continuous glucose monitor on them for 2 weeks and helping them see what's happening with their blood sugar as they eat different foods, engage in different activities, just something simple like that. A 2-week CGM program can be incredibly engaging and exciting and lead to some incredible insights for patients. So the tech just gets better. Clients and patients learn how to self-manage more effectively. You don't need to be a rocket scientist to look at the data and know what you just did and see whether that was good or bad in the numbers. It's actually quite simple. Just the data alone can drive significant behavior change. I know that some people would probably debate me on that, but we've been doing this with tens of thousands of users, and we see it every day. The remote monitoring can also help you intervene, especially if you're starting to get notifications saying a person's numbers have gone in the wrong direction for 2, 3, 4, 5 days in a row. Or conversely, the person's numbers have gone in the right direction for that same amount of time, and that's an opportunity to provide positive reinforcement. And remote monitoring and data analytics, which is essentially at the core of this, just provides incredible insights into lifestyle causes of chronic illness. When you combine that with functional testing from Rupa, you now have a really, really powerful combination. You'll have the lifestyle data, you'll have the functional testing, you'll be able to design a protocol, implement the protocol, watch the protocol roll out in real time with biofeedback coming straight off of the clients. And then ideally, you've got enough insight between the tests to rerun the test, know exactly what happened between tests, and really get things dialed in. So that's pretty much it. That's a very high-level introduction to remote patient monitoring. Cody, I'd love to take some questions here now, and I'll stop
Awesome.
share.
Absolutely. Thank you so much, David. That was super insightful. One of the first questions we have is the type of licensed professionals or what type of licensed professional is required to bill for this type of patient monitoring. Specifically, one came in referencing that they are an RN and looking to do this without a licensed doctor. If you could talk more to that to begin with.
Yeah, obviously this only applies if you're going to be billing inside the payer system, but the requirements are medical doctor, nurse practitioner, osteopathic, so DO, and there's 1 or 2 other designations that can sign off on the claims for remote patient monitoring. So I can provide a follow-up if needed, but just looking up the credentials that can sign off on the claims, the day-to-day can be done by any auxiliary staff, health coach or otherwise. But signing off on the claims, MDDO, nurse practitioner, there's 1 or 2 others that are qualified to sign off.
Awesome. Thank you so much. The next one is who typically pays for these devices? Did I lose you? Let me.
Yep, thanks.
No
worries. It's just if we're getting whoever's the host can't unmute themselves, and I know we've been passing back and forth host permission.
No worries.
So that's an excellent question. Inside the payer system, the 99454 code, which is $50 to $70 per patient per month, that's intended to offset the cost of the devices. So in that model, the provider is paying for the device and then using the code to reimburse on a monthly basis. So the $50 or $60 a month is designed to offset the cost of the devices, and you can bill that monthly. So honestly, an Apple Watch now is an approved medical device with physiological parameters, including blood oxygen, resting heart rate, ECG. So you could put all your patients on Apple Watches, bill the 99454 code, offset the cost of the watches. And in that model, it's technically the insurance company. In other cases, if it's a type 1 or a type 2 diabetic, they may be getting the device covered by the insurance company. the CGM or the glucometer or the strips. So they may have coverage as part of their diagnosis. And if it's cash pay, you can kind of do whatever you want. You can allow patients to bring their own device, or you can include it as part of your program.
Awesome. Thank you for that. And the next one, we're going to do 3 more questions. What are some of the differences in RPM programs between integrative and conventional medicine practices?
Well, typically, there's a number of, in the conventional world, there may be practices, they're 100% insurance based. And by default, they're going to have a larger percentage of their patients that have a qualifying condition for remote patient monitoring: diabetes, heart disease, obesity, et cetera. So I think in a conventional practice, there's going to be a larger pool of patients that qualify for RPM. In the integrative practice, it tends to be a mix. There's half the patients that are focused on health optimization, lifestyle modification, things that are not billable to insurance. And there's a smaller subset that have a qualifying condition and insurance that would pay on RPM. So typically in the integrative practice, the RPM patients represent a much smaller pool of the overall patient population relative to practices that are purely inside the payer system.
Awesome. Thanks again. Okay, for question 4, can we share more on health coaches, can you share more on how health coaches can complement an RPM program, kind of the relationship in there?
Yeah, I mentioned that several times, but remote patient monitoring, whether it's for a chronic condition or health optimization or longevity or weight loss, it requires somebody to be looking at the data. And that's an ideal role for a coach. And the data provides the opportunities for the coach to engage. They're trained to provide positive patient engagement, lasting behavior change. But when you combine that with the data, that becomes, I think, a winning formula. And that formula can work inside of a cash pay practice where you're doing cash pay programs that the coach is running. That's what I presented with GladMD. They're 100% cash pay. And the health coach is running weight loss and fatty liver and other programs. They're charging X hundreds of dollars per month. It's 100% cash. And in other models inside of the payer system, the health coach can be doing the day-to-day monitoring and running the RPM program as long as you have the licensed provider to sign off. So coaches can work in either model, and it allows the coach to start generating revenue inside the practice instead of just being a cost center. So I think there's lots of reasons to bake a coach in, regardless of how your practice is structured.
Awesome. And then the final one. So are the same codes used when health coaches are providing the care under a provider, or are their codes different?
It's the same codes. I'll mention that there are experimental CPT codes out there now for having health coaches on staff and health coaches delivering services. The last I heard, those codes are experimental, so they're not approved yet. But there may actually be more codes for the health coach to do their thing in addition to the RPM codes. But the coach can do all of the work necessary on a day-to-day, week-to-week, month-to-month basis to build those RPM CPT codes that I covered here. That's a recent change. And that means the coach can come in and really start to drive some revenue right away. So it's a perfect opportunity to use coaches. So more explicitly, Cody, yes, the coaches can do all of the work necessary to build those codes, as long as you have a licensed provider that's submitting and signing off.
Perfect.
What else?
Thank you again, David. I think that's it. We can wrap it up. Just a reminder for everybody that showed up late, this session is recorded. We'll send out that recording in the next 24 hours. If you have any further questions, you can follow up with us, and we'll pass those on to David and connect you there. Thank you again for joining us, and have a lovely rest of your day. Thanks again, David.
Thank you, everyone.